Welcome back, everyone. Today we are diving into the final guideline of CPT Anesthesia chapter Qualifying Circumstances. This section is crucial for understanding how specific factors and conditions can impact anesthesia administration and billing. Welcome back to my YouTube channel. If you are new to my channel, welcome to MedCode Insight. Hi, I am Nishaba, a certified medical coder. In this video, we will explore what qualifies at qualifying circumstance, how they influence anesthesia procedure, and how they documented in medical coding. So let's jump right in. Qualifying circumstances. Qualifying circumstances in anesthesia refer to specific situation or condition that may require additional effort, time, or complexity during the administration of anesthesia. These circumstances are identified by specific code in medical coding. It includes emergency condition, prolonged services, or administration of anesthesia to patient with extreme age. More than one qualifying circumstance may be selected. Many anesthesia services are provided under particularly difficult circumstances depending on factors such as extraordinary condition of patient, notable operative conditions, and or unusual risk factor. Qualifying circumstances significantly affect the character of anesthesia service provided. This procedure would not be reported alone but would be reported as additional procedure number qualifying an anesthesia procedure or service. All qualifying circumstance code are add-on codes, and these add-on codes are used in addition to code for primary anesthesia procedure. First add-on code is 99100. Anesthesia for patient of extreme age younger than 1 year or older than 70. There is an instruction in the parenthesis. For procedure performed on infants younger than 1 year of age at time of surgery, see codes 00326, 00561, 00834, 00836. According to this instruction, we cannot use 99100 along with these codes, as these codes are combo codes and they already contain information regarding age. There is no need to add additional information regarding age. Next add-on code is 99116. Anesthesia complicated by utilization of total body hypothermia. Next add-on code is 99135. Anesthesia complicated by utilization of controlled hypotension. Next add-on code is 99140. Anesthesia complicated by emergency condition specify. An emergency condition is defined as existing when delay in treatment of a patient would lead to a significant increase in threat to life or body part. For better understanding, let's discuss each code individually. First qualifying circumstance add-on code is 99100. It represents that the anesthesia for a patient of extreme age younger than 1 year or older than 70. This code is used when providing anesthesia services to a patient who are particularly at risk due to their age, either being younger than 1 year or older than 70. Let's take an example. A 75 years old patient is undergoing a complex surgical procedure that requires anesthesia. The anesthesia provider administers anesthesia tolerated to patient's age and any related health consideration. In this case, the anesthesia provider would report both the primary anesthesia procedure code for surgical procedure itself and additional add-on code 99100 to denote that anesthesia services were provided to a patient of extreme age, someone older than 70 years. The usage of 99100 is to ensure accurate documentation and reimbursement for the additional care and consideration required when administering anesthesia to patients who are particularly at risk due to their age. Our next qualifying circumstance add-on code is 99116. The code 99116 refers to anesthesia complicated by utilization of total body hypothermia. This code is used when the administration of anesthesia is complicated due to deliberate induction of total body hypothermia, which involves lowering the patient's body temperature for medical purposes. Let's take an example. A patient requires a complex surgery such as open heart surgery, where the surgical team decides to induce total body hypothermia to protect the patient's organ and tissues during the procedure. The anesthesia provider would administer anesthesia while carefully managing the patient's body temperature to achieve the desired hypothermic state. This involves using specialized equipment and techniques to monitor and control the patient's temperature throughout the surgery. In this scenario, the anesthesia provider would report the primary anesthesia procedure code for surgical procedure along with add-on code 99116 to indicate that the anesthesia administration was complicated by the utilization of total body hypothermia. Next qualifying circumstance add-on code is 99135. This code represents anesthesia complicated by utilization of controlled hypotension. Let's take an example. Consider a scenario where a patient requires extensive surgery. To minimize bleeding and improve surgical condition, the surgical team decide to induce controlled hypotension. Controlled hypotension involves deliberately reducing the patient blood pressure to a lower than normal level during the surgery. It helps decrease blood loss and improve visibility for the surgeon. In this case, the anesthesia provider would administer anesthesia while carefully monitoring and managing the patient's blood pressure to maintain the desired level of controlled hypotension throughout the surgery. This may involve anesthesia medication and fluid administration to achieve the desired blood pressure parameter while ensuring the patient's safety. The anesthesia provider would report the primary anesthesia procedure code for the surgical procedure along with additional 99135 code to indicate that the anesthesia administration was complicated by utilization of controlled hypotension. Our last circumstance qualifying add-on code is 99140. Code 99140 is used for anesthesia complicated by emergency condition. This code is used when anesthesia administration is complicated by emergent nature of the medical situation, which may require rapid decision making and intervention by anesthesia provider. Let's take an example. A patient presents to the emergency department with a ruptured appendix. Emergency surgery is necessary to prevent further complication. The anesthesia provider is called to administer anesthesia to the patient immediately. In this case, the anesthesia provider must quick assess the patient condition and provide anesthesia in emergent setting. Due to urgency of situation, the anesthesia administration is complicated by the need for rapid decision making, close monitoring, and potential adjustment to anesthesia techniques and medications. The anesthesia services provided in this scenario would be reported using the appropriate anesthesia procedure code along with Addon Code 99140 indicate that the anesthesia was complicated by emergency condition. Always refer to the most recent CPT guidelines and update for accurate and detailed information. If you have any question or need further clarification, feel free to ask in the comment section or reach out via email. Thank you for watching. If you enjoyed the video, please like, share it. Your support means a lot to me. If you haven't already, consider subscribing for more. Click the bell icon to receive notifications. For more detailed guidelines, CPC mock or exam related questions and notes, email me at my given email ID.